In the following lecture, we're going to talk about the Erector Spinae group. Now, this is a group of muscles that essentially are responsible for erecting the spine and keeping the entire spine and upper body stable. We've got the longissimus thoracis, which is essentially the longest erector spinae muscle. Now, both of these two muscles here will start from the sacral area, and the longissimus will essentially travel all the way from the bottom of the sacral area into the bottom of the skull here, so into the occipital area. And then the iliocostalis muscle, which is the one that wraps around. This one essentially wraps around the ribs, so it's a bit wider than the longissimus. It doesn't really go all the way as far as the longissimus, but it comes pretty close because they essentially help each other support the spine. Okay, so they work as a pair. And that's why they're so close to each other, and that's why they kind of, that's why they provide the same function here. And then we've got the spinalis thoracis, which is this one here. So if you can imagine that these two are superficial, and then this muscle is essentially underneath these two. So that's why we've kind of drawn it on the other side, just so you can see where it is. Now, obviously, we got Chantel's vertebrae here, but if you imagine how this muscle starts from the spine here, just below the last ribs, and then it travels on the ribs here, and then it crosses over on the other side. So now the main movements that we're going to talk about here, and we are going to show you in a second what those look like. We're looking at lateral bending, which is this movement, and we've got the spinal extension. Now, and essentially the name of these muscles, so the entire group, Erector Spinae, gives out their main action, which is to erect the spine. And that's how easy it is to remember what these muscles are there for. And then as the muscles travel up into the body, the pain can kind of transfer anywhere along the length of these muscles. So if you've got SI joint problems down here, this could be related to the Erector Spinae muscles. If you've got like thoracic pain here, so a lot of people will tend to have a lot of issues in between the shoulder blades. So it might not be the rhomboids that's causing the pain. It might be the erector spinae that are essentially traveling all the way up into the neck.